SRM Institute of Science and Technology, Engineering, Medical and Health Sciences, Management, Dental, Science and Humanities, Law, Agriculture Sciences, Hotel Management. Admissions open.
When you live in a fast-moving, ever-changing world, life brings forth unlimited possibilities. Yours to explore, excite, enjoy, educate, evaluate, and elucidate with elan. Never stop moving forward with Darwin Platform Group. Darwin Platform Group, the visionaries.
Thyrocare, the trust, the truth.
With that, we come to our panel discussion on future of healthcare post-COVID. We continue with the focus on health. At a time when everyone is taking precautions, we have a panel discussion on the future of healthcare in the post-COVID world. We have with us a stellar panel. Joining us is Dr. Krishna Ella, Chairman and Managing Director of Hyderabad-based vaccine developer Bharat Biotech, Dr. K. Srinath Reddy, President, Public Health Foundation of India, and Dr. A. Velumani, Managing Director, Thyrocare. And moderating this conversation is my colleague, Mr. Rajiv Dubey, Editor, Business Today and Managing Editor, Business TV Today Network.
Welcome to this Business Today Mind Rush panel discussion on the future of healthcare post-pandemic. Welcome all panelists. Welcome to you all, gentlemen. We'd like to discuss essentially how should the world and particularly India be handling pandemics or outbreaks of this nature. We'd like to understand from you how should vaccination drives be. We'd like to understand how should our preparation be. So if we could start out by maybe about a couple of minutes from each of the panelists trying to understand what are your broad views on how should we be prepared for a future where pandemics may necessarily be a part of our lives rather than exceptions. Should we start with Dr. Srinath Reddy?
Thank you. We do recognize that pandemics are likely to be a recurring threat. Indeed, we have had zoonotic infections springing up over the last 60 years with great frequency and accounting for more than 2/3 of all new infectious disease outbreaks. So our preparation for the new pandemics, and we hope we should be able to avert it, but nevertheless, we should be fully prepared for it. The preparation must start with ecological balance, which prevents deforestation and extensive animal breeding, which provides a conveyor belt for forest-dwelling viruses and vectors to enter the veterinary habitat and the human population. Secondly, we need very effective community-based surveillance systems in the human population. But before that, the One Health surveillance or the eco-surveillance, which connects surveillance of wildlife to veterinary life and human life, that's going to be very important, and that's been a neglected area in the past of infectious disease surveillance. Within the human communities themselves, we need very strong community-based surveillance, particularly from primary health care, so that we can get very early alerts for immediate response. Then, of course, we need to strengthen our health system at every level, primary, secondary, and tertiary care, to anticipate what the healthcare system needs are going to be, right from diagnosis to effective treatment and isolation. And there we must ensure that we have adequate health force and adequate investments and appropriate use of technology. I think each of these elements must be strengthened along with multi-sectoral coordination between various elements of the government as well as other sectors, including the private sector. And even in the health sector, bringing about fairly responsible public-private partnerships would be an important element.
Dr. Ella?
Thank you, Raju. I think, there are 40,000 unknown viruses globally. We don't even know. And 10,000, out of that 10,000, 25% of that 40,000 are zoonotic. Zoonotic means from animal to animal and to human, or animal to human, whatever it is. Today, what is happening is with the economy growing, deforestation happening, urbanization is happening. We are now going closer to the animal. Animals are not coming closer to us. We are going closer to the animals because of deforestation. So what is happening in that process? We are now cohabitant with animals. And in the process, the animals, the viruses are crossing each other. And viruses are very intelligent one. They are, although they are a non-living organism, it's absolutely doesn't live on its own. It needs somebody to live. So it finds a niche of mutation that is required to attack human beings. And it is going to increase. What we have seen, only 30 or 40 viruses are known now in the pandemic right now. There are another 9,800 is expected, and it is going to increase. The reason it's going to increase, the global travel is also increasing. A disease which is just there in Thailand will spread to US or Canada in just question of 12, 14 hours of flight. So I think earlier movement was not that much global travel. It was restricted to the place where it was. So it's going to happen. And the developing world, particularly like India, China, Thailand, Vietnam, Cambodia, are the places, and Africa, are the places of the all neglected diseases. All neglected disease turns out to the pandemic, whether Zika, chikungunya, or even COVID-19, or even pandemic flu, everything starts from the developing world. So I think, if US want to control, Europe wants to control this pandemic, it has to be taken care of where the origin is. And we need to be alert, and really we can contribute to the global health from the developing world can contribute to the global health. Thank you. Over.
Dr. Velumani.
Thank you, Rajiv. And I have a opinion from last one full year, which is remaining unchanged. Ever since it was known in January, I felt India is safe for various reasons. One among the reasons is India is an young country. And if you look at after one full year, this virus is more killing rich, less killing poor. And I don't know whether there is statistics in India, rich cities and poor towns. But in my opinion, calendar year 2019 did not have any lesser death than calendar year 2020. If there is some statistics available, I have still not happened to see it. Having lost 1,300 deaths per million, the Western world is very desperately looking for vaccines to escape from it. India, we have lost 100. Instead of 1,300, we are just 100 per million. Of course, loss of an individual for a family is too big a loss, but for a loss of today, it counts around 350 per day for 1.35 billion population, which says gas pressure cooker is now safe. Having said that, the vaccines are important. Vaccines are important, but is that true? Pandemic is another question, because in April, I don't think many of us felt that we will see happy year 2021. To that extent, the media had terrorized every common man. To that extent, today the pressure is on vaccine, not because of the virus itself. It is because of the terror which public have undergone. Yeah. So I am of that opinion. Vaccine, it takes its own time. Any process to hasten it has risks attached to it. And India can afford to take it little later because of the less mortality. And in my opinion, this as a virus isn't as bad as it was expected or told or feared to be. It needs to be handled. Even if death rate is very low, it needs solution. And if there is a cost effective, I'm saying cost effective as well as efficient one, it should be made mandatory by government. And by the end of 2021, we should see almost all have got vaccinated. And it's a huge country. It's a huge logistics and procedural challenges. But I'm pretty sure we, as Indians, have succeeded much earlier, much faster, as Asians have done it much better compared to the rest of the world. Thank you.
Where does vaccine development go from here? Is this going to be now the template with which vaccines can be developed, should be developed, because now we've proven that there could be effective vaccines which can be developed and produced and rolled out in a much shorter span than the 10, 11 years it used to take. So may I ask Dr. Ella first on this?
Thank you, Raju. I think, in the process right now, we understood what are the problems to develop a vaccine, whether reagent, whether DNA synthesis, or we don't need a virus also now. How do you make it, reverse genetics approaches? I think a lot of technology platform, which we missed in the country, have now understood that we need. Actually, I'm proposing to the government, we should have some task force on pandemic issues. What are the things required surrounding if anything happens in the future? We don't depend on a reagent coming from US or from China, all those things. So we need to be aware of it. That was a major problem we had encountered in a vaccine development. A lot of QC reagents, nothing was available to us till April. So 4 months we lost a golden opportunity as a companies. So I think, well prepared, but I don't want to talk too much on a vaccine business because it's a conflict of interest. But certainly what I will say is, it is now again going to, everything vaccination was thought about only children's all this time. The 25 million children were the important, and they were the one vaccinating. No adult vaccination was happening anywhere in India at all. So now I think the awareness of a vaccination increases. And the second is, look at the pandemic. What, as Velumani said, I'll agree with him, not many deaths has happened, but it collapsed the economy. So what pandemic has asked us not to kill the economy, the people's death, but it has really collapsed the economy of a country itself. So that is what we have to look for. If you want the economy not to collapse, then we need to be prepared ourselves better. And it gives us some confidence level. If your technological advantage is there, it gives you some confidence. Yeah, okay, there's something is going to come. And that type of strategies we need. And I think vaccine will be one of the tools. I'm not saying that is the only tool required for the public health point of view. Even our hospital system will develop, ventilators will develop, SOPs written for the entire country's primary health care system. SOPs can be built up and now. I think the whole chain of reactions is going to happen from the government policy decision up to the ground level at the primary health center. So now we are going to see from top to down connection. Thank you.
But Dr. Ella, the way this vaccine has been developed, could this be the template for future vaccine development or even drug development for that?
Yes. I think it will happen now, and the future will be. Can we stop only with animal challenge studies? That's number one option. Number two, if it is something less pathogenic, can we do human challenge studies? Can we do it fast track? In 2 months, we have an answer. This vaccine works or not in the human challenge studies. So animal challenge, human challenge, all this will again fast track a lot of trial. And the regulators have now learned how to do fast track a clinical trial and how to regulatory can be fast track now in the country also. And I think everything has changed in the country. To be frank with you, country has progressed according to the speed required. But as a manufacturers, we couldn't progress fast because of the reagent, other requirement was a little bit blocked for us in the beginning. Okay, but it will change the game. Thank you.
Okay, Dr. Velumani.
Yes, I think no prediction of what virus will come and keep all reagent ready, all vaccine ready, impossible. Virus will come, whatever permutation combination of nucleotides can trigger any kind of toxicity. But having said that, there are some virus spreads fast, kills fast. I don't think you will ever have any solution only. There are some which will spread fast, will not kill fast. That is this COVID virus. And there are some which will spread slow and will kill very little. For that, you can take 10 years to develop a vaccine. So this virus, ever since it has come, I'm seeing a wonderful power of human being. The first kit which I purchased for a PCR test was 1,400 rupees. Mind you, there were only 2 or 3 vendors.
Yeah.
But today, in January exactly after 10 months, it has come to 140 rupees. And mind you, there are not less than 500 manufacturers. 1 year for one virus, this many people, that's a very powerful creation. This drill, power drill, what you call as, fire drill. This fire drill is very powerful. And I'm pretty sure even the vaccine manufacturers, it is not that simple to make vaccine so early was told in the beginning of this year, last year. But I am pretty sure they also know the template, how to incise that virus, how to pick up those vital proteins, vital components and raise some kind of vaccine which is safe enough and fast enough. So I think we are today better than what we were before this fire drill, both diagnostics as well as treatment. I don't think one more virus will scare us as much as this one has scared us. But having said that, this virus was good. It only gave more education, killed very little. This is my perception.
Okay. Dr. Reddy?
Well, before I move on to the actual vaccine issue, let me comment on a few of the remarks that have been made earlier. Non-specific immunity is very important, and the number of exposures to respiratory viruses and other viruses since our childhood would have certainly increased the non-specific immunity, not only in India, but in South Asia, in Africa. And in all of these places, you are seeing low mortality, apart from the younger age and the higher rural population where the spread of the virus is slower. These are the common characteristics of countries with low mortality. But it's also true that public health measures like physical distancing and masks helped in reducing the transmission. And there is a clear-cut logic of evolutionary biology, especially for respiratory viruses, that if the virus finds it difficult to spread, it then becomes less virulent and tries to increase its infectious nature, because the virus will not want to die out as a species. So evolutionary biology will drive it to enhance its infectivity, but not to exhaust its host. And by creating a bumpy road for the virus to travel, by masks and physical distancing, etc., we are actually doing that. We are making the virus, even the new mutants that have been reported from UK and South Africa, they are more infectious, not more virulent. And possibly over time, they'll be proven to be less virulent. So these public health measures are important. Now, as far as the vaccines are concerned, the amount of attention and resources, monetary as well as scientific, that were devoted to the development of vaccines in this particular case was because the rich, affluent Western countries got the maximum damage. If it was happening in Africa or in some corner of South Asia, they wouldn't have put in so much of resources. So to that extent, it is good that science responded with adequate support, both in terms of finance as well as in terms of governmental regulations being relaxed. But I think it is absolutely important that the gains that science has provided us in providing multiple platforms of vaccine development, multiple avenues of drug development, of trying to ensure scale of production, all of these are going to be important gains for the future. And that is something that we must continue to preserve.
How do you see the current controversy that prevails on the issue of vaccination, especially the efficacy of the vaccine? And there's, Dr. Ella's company is one of the companies that has developed a homegrown vaccine. And then there is, of course, the serum one. Pfizer hasn't yet got an opportunity to present its case. But on the issue of efficacy, how do you see this playing out?
Well, I do not wish to get into the controversy. In fact, I may write a piece about it, but at the moment I've desisted because I'd like to understand the issues very well. Clearly, efficacy is judged on multiple ways. One, of course, is the whole area of studying immunogenicity in animal models as well as in human beings, and then proceeding to a clinical trial of looking at the amount of severe COVID infection, severe COVID disease being prevented in people who are immunized. It's true that infection with the virus itself may not be prevented, but clinical disease can be prevented in people who are adequately immunized because the body then learns to fight back. But even infection could possibly be prevented by what are called mucosal vaccines, which are actually providing the sterilizing vaccines, which even prevent, when inhaled, the virus from settling down into the respiratory tract. But those are still under early development and evaluation. But it is true that we do require a completed clinical trial for assessment of efficacy, whereas safety has already been seen at various stages. However, if there is reasonable proof from some of the earlier stages that there is adequate proof of efficacy in terms of the stage 1 and 2 trials, demonstrating a good antibody response and other immunological response, then we can possibly look at some of these vaccines as promising. But I would like to see the phase 3 clinical trial completed and the results fully presented before we certify that efficacy has been amply proven.
Dr. Ella?
I don't want to get into controversy, as Srinath said. What I would say is, having 25 years experience in the vaccine field, there are two ways to look at it. There are some viruses which the immune response is not right one to compare. For example, rotavirus vaccine. You look at the immune response to rotavirus is very bad. It doesn't produce much immune response at all in a body. So we depend on an efficacy trial, whether it works in a field situation, in a diarrhea. That's one option. There are other viruses like Japanese encephalitis, hepatitis B, and rabies. All these are viruses where we look at immunogenicity as an end marker. It's not that I'm denying the phase 3 efficacy is not required. Please underline that it is required. I'm not saying that. But you have to come out some conclusion, somewhere quick response. If you want, do you look at the immune responses to RBD, antibodies to RBD, antibodies to S protein? You look at it as an end marker. So look at it, can we make some judgment out of it? Yes, we can make some viruses, we can make a judgment. Efficacy, I'm not denying that. We are going through efficacy and we'll be completing that. I mean, I think today will be the last day. We'll be completing 26,000 people. Probably today will be the last day for us, completing our entire enrollment of 26,000. There are some people questioning us, oh, how come, you were 13,000 when 2 weeks back, now you're 26,000. Media raises some suspicion on this sort of thing. I think we are given the clinical trial to Equa, which is a multinational, American multinational company. The reason we gave, because people doesn't trust Indian companies. So we have to give it to the American company to vet our data. That's the sad part of this country, okay? So we give it to them, and I think we will be producing any data which is our global standard. Nothing like Indian company, will be a global type of data will be there. Thank you.
Thyrocare, the trust, the truth.
My family is my anchor. My wife, Mona, and our 2 daughters, Naina and Roshni. And thankfully, Naina and Roshni, who are in Boston, they're studying in Boston. They have come home because the schools where they are, they have both remote as well as in-class learning. So they have spent a fair degree of time with us. So that gives me a huge amount of joy. Seeing them grow, seeing them develop, seeing the passion in life. The other key bit for me is I'm a great lover of sport and love watching sports, not as much as playing sports. The other passion is reading. I love reading, and generally I read a few books at a point of time. And that is another way for me to relax. When we had the hard lockdown and even the jogging track in our building was shut down, Mona and I started walking down and up the stairs. And we used to cover about 20 floors every day to flex some muscles and do some exercise. But since things have become more normal, we make it a point to walk on the jogging track at least 30 minutes a day. And over the weekends, we try to do it morning and evenings. And then thrice a week, I have a good trainer who does strength training on the Zoom. It keeps changing. Yeah, I'm still a mountain man. Between going to a beach or going to the hills, given a choice, I would go up the hills. But the struggle is my family, they would more prefer going to the beaches. So invariably, I have to accept their choice. But my favorite spot would be still up the hill. Most indulgent purchase. My Armani jacket. I would say is a house on Palm Jumeirah. Yeah, with you get up and you see crystal clear emerald waters from your bedroom. So that would be a luxury possession.